I am Dr. Ryan Lombardo. I am the Wellness Director here, and we're going to talk about PHYSIQ, which is the newest and latest advancement in body technology. So, PHYSIQ is one of those treatments that we use to help tighten, tone, lift, contour, can do many different things, is applicable to many different areas, like the abdomen, the bra line, inner and outer thighs, lower back, pretty much anywhere you have a little extra that exercise and diet is not targeting very well. So we have our model here, and we're going to give an example of what it's like to treat a small pouch on the abdomen. But beforehand, I want to talk a little bit about what PHYSIQ is. So PHYSIQ is this device here. I'm hoping you can see it on camera. It has 4 applicators, and it uses light-emitting diodes. It's called a superluminescent diode matrix. It's 850 nanometers, which means it penetrates the tissue deep into the fat layer, so it bypasses the nerve endings, so it is virtually painless. Slight warming sensation is about all you'll feel. Plus, it has a 120-degree angle of the diodes inside, so it's not just targeting this area immediately under the handpiece, it's also targeting the areas around, so you get a nice even treatment around the whole area. With 4 applicators, we can treat quite a large area, and we can also do multiple treatments at the same visit or multiple areas as we go, as the patient progresses through treatment cycles. You can see 4 applicators is not just this small rectangle, it's actually more like this, plus or minus on the top and bottom as well. What we can do is give a little bit of an example while we're going to treat our model here. She's experienced this treatment before and was gracious enough to let us treat her again today. One of the main benefits of PHYSIQ is that the patient gets to spend some downtime inside the room, not outside of the room. There is literally no downtime after this treatment. She'll be hanging out in here, having this treatment for approximately 25 to 30 minutes. Then we'll come back in, pull everything off, she'll go on her way and conduct her normal daily activities. No harm, no foul, no residual, and then we'll repeat the treatment again in 2 weeks. We do this every 2 weeks for 5 weeks. Again, we can target multiple areas, optimize results, faster treatments, no downtime. It's pretty awesome. So we're very happy to be one of the first 10 practices in the United States to offer PHYSIQ. Renee, what was your experience like?
I really couldn't even tell you anything different that happened. I just sat in here for 30 minutes. I didn't feel a thing. It was great, and then I went on my way. And I'm just looking to wear a bikini again after children. That exercise and diet haven't allowed me to do as much as I'd like to. So this treatment is fantastic, fabulous. I'd recommend it to anyone. It was so easy, and I can't wait to see my results in a month or so.
All right, so I'm going to lay our model back a little bit. I'm going to put a bolster under her knees to make sure she's comfortable, and then we'll apply the hand pieces so you can all see how this works. Are you ready? Comfortable?
Yes. Thank you.
Okay. Okay, let's give you lift up your legs a little bit. How's that?
Perfect.
Cool. Excuse me. Turn on the machine. The machine is a little noisy, so hopefully you'll still be able to hear us. Oh, turn it on. What happened here? Sorry everybody, technical difficulties from moving devices around all day. Here we go. Let's take a look at the spot we're going to treat while this warms up. So we have this nice little strap to hold the hand pieces in place. There is also, so you'll see the difference between these applicators. We also have a little silicone sticky that attaches to the body as well. So Renee, I'm going to have you fold down just a bit. I'm not sure if you can see, but before we treat, we always mark the area that we're going to treat while the patient is standing. Therefore, we can see exactly the area that we're going to place the applicator, because once you lay down, things tend to shift a little bit depending on the patient. So in this case, we'll go this way. We'll apply the first one right there. Do the same thing on this side, right there. Trying to keep full contact with the skin and a slight gap in between. We will put this wrap right here, make sure everything stays in place. Choose abdomen. Create our settings, get ready, and go. This is literally all we do. Our patient's going to hang out here for a little while. We do have one nice little added benefit of PHYSIQ is that there is the ability for a patient to regulate comfort with our little comfort button. It's called, it alters the duty cycle, does not affect efficacy, but alters the way the light is being emitted. It's very rare that anybody needs to push it, but it does give the patient a little bit more control over how they're feeling. So what we're going to do now really is kind of sign off and let our model hang out and kind of get some rest. I'm sure some much needed rest. And instead of us coming back at the end to show you, what we've done, it's kind of unremarkable actually immediately following. Like I said, there is no downtime. You can kind of leave and go about your daily business. So I hope you've enjoyed our little segment on the PHYSIQ.